Sawadika. Good morning, everybody. My name is Dr. Paul Zambrano from Alive and Thrive. On behalf of Alive and Thrive, I would like to thank all of you for inviting us to this important event. It's our pleasure to be in front of you this morning to talk about a topic that I'm sure we all love and are very passionate about. So before I start, let me greet our distinguished colleagues, representatives from the medical associations, colleagues in the nursing and medical professions, Ministry of Health. But I think we are all advocates for breastfeeding in this room, so I'd like to extend greetings to all of you and again to thank you for the opportunity to present to you this morning. But before I start, let me tell you a bit about myself and my background and why I'm standing here in front of you this morning. So I'm a medical doctor by profession. I graduated, I won't tell you, so I won't sound too old. But I also have a Master of Science in Nutrition for Global Health from the London School of Hygiene and Tropical Medicine. But I think my most important qualification in standing in front of you today is I'm also a father of 2 children, 2 wonderful daughters. Both of them were exclusively breastfed, and one of them continued to breastfeed until 2 years and even more. And my youngest daughter is 3 months, and she is, of course, still exclusively being breastfed by her mother. So, with that, let me start by showing you this photo. This is a photo from our colleagues in UNICEF in Indonesia. So here you see 3 children, 1, 2, 3. So if you look at them, they are roughly the same size, roughly the same length. But the first 2 children are 2 years old. And the last child, this child, is 7 months old. Okay? So, a key difference between the first 2 children and the last child is that the last child was exclusively breastfed by her mother in the first 6 months of life. And the first 2 children who were not exclusively breastfed suffer from a condition that we call child stunting. And have you all heard about child stunting before? I assume many of us have. So child stunting is defined as having a low height for age based on the global child growth standards. And it's a condition that affects more than 10% of children in Thailand as of 2016. So stunting is not only important because of height, it's also important because it is related or associated with a loss in development and a loss in potential, not only in the growth of a child, but even up to earnings and earning potential when the child grows as an adult. This is based on longitudinal studies from countries like Brazil. And this is partly why. On the left side is the brain of a healthy, well-nourished child. On the right side is the brain of a stunted child. Both are 3 years old. You can clearly see the morphological difference between the brain sizes. And at the cellular level, these changes are also apparent. If you look on the left side, you can see very well-connected dendrites, very well-connected, healthy-looking neurons. And on the right, you see that the connections are not as well-defined. There are not as many connections. And this is very well established. We know that in a healthy, well-nourished child, in the early years of life, you can have up to 1,000 new neural connections per second forming in the brain. Not so in a stunted child. But we also know that stunting occurs or starts to happen, or growth faltering happens very early in life. This is a graph based on longitudinal child growth studies from many countries, multiple studies, both low and middle income and high income countries. And it shows that when growth faltering starts early in life, reaches this point, and one thing you notice is after 24 months, the growth is not recovered. Stunting is largely irreversible after the second year of life. But we also know, thankfully, that we have a window of opportunity to prevent this, and this is the first 1,000 days. The first day of pregnancy or the first day of conception up to the second year of life of the child is the critical window of opportunity to prevent stunting. And the most important intervention to prevent stunting in this critical window is breastfeeding. And by breastfeeding and infant and young child feeding, What we mean, I'm sure we all know this, but it's good to be reminded that we are not talking only about exclusive breastfeeding, but we are talking about one, early initiation of breastfeeding within the first hour of being born by putting the child to breast. Second is exclusive breastfeeding or only receiving breast milk, no water, no formula, no other food in the first 6 months of life. And thereafter, the child should continue to breastfeed until 2 years and beyond while receiving nutritionally adequate, age-appropriate, and safe complementary foods. So what is the status of breastfeeding in Thailand? This is based on the multiple indicator cluster survey published just last week. So as of 2016, in Thailand, again, only 40% of infants born are initiated to breastfeeding within 1 hour of being born. Only 23% of children are exclusively breastfed in the first 6 months of life. But note that it almost doubled from 2012. It used to be 12, it's now 23, so it's almost 2 times higher rate. So by the first year of life, only 33% continue to be breastfed, and by the end of 24 months or 2 years, only 15.6% continue to be breastfed. Now back to exclusive breastfeeding. Despite having your rate almost doubling in the last 4 years, Thailand still has one of the lowest exclusive breastfeeding rates in the region. So this is Thailand. And this red line represents the global nutrition target of 50% exclusive breastfeeding. So by 2025, to meet the target, Thailand again needs to double this rate in the next 10 years. So we're all medical professionals in this room, or advocates. We've been working on breastfeeding for most of our careers, and we're already very well familiar with the health benefits of breastfeeding. We know that it prevents the 2 main causes of child deaths in the world and in Thailand, diarrhea and pneumonia. We already know that it helps reduce the risk of breast cancer in women, and we already know most of its other effects. But last year, the Lancet Breastfeeding Series was released. The Lancet is one of the most prestigious medical journals in the world, and it released the Breastfeeding Series, which highlighted again the benefits of breastfeeding, not only for the child, but for the mother, and more importantly, for the population. So let me summarize the main findings of the Lancet Breastfeeding Series. It found that improving breastfeeding practices around the world can save more than 820,000 lives every year, just by improving breastfeeding practices. Second, it found that for each year of breastfeeding, a mother's risk or probability of getting invasive breast cancer is decreased by 6%. Longer breastfeeding means more reduced risk for the mother. And totally, improving breastfeeding, or let me say by not breastfeeding, we lose $300 billion every year. And we lose it because of many things that I will talk to you about later. But these are global estimates. What does it mean for Thailand? So Alive and Thrive worked with UNICEF to conduct a cost of non-breastfeeding study specifically for Thailand. And what did we find? We found that not breastfeeding has a cost. And the cost is not necessarily lost money. Essentially it is, but the cost comes from these 5 areas. One is from mortality. There is an economic consequence when children die and when mothers die from conditions that could have been prevented by breastfeeding. And we also know that there is a cost to the health system. As a public health professional, we often study Thailand's health system and health financing system as an example of a country that is close to or has achieved universal health care. And it's a good example of health financing. And it's important to Thailand because excess cost for treatment of diarrhea and pneumonia that could have been prevented by breastfeeding continues to cut into our resources that we could use for universal health care. Third, there's an indirect cost. Families whose children get sick because of diarrhea and pneumonia not only pay for medicines, they also pay for travel. And there are other indirect costs Fourth is the direct cost by buying formula. Simply put, if you breastfeed, you don't have to buy formula and you save a certain percentage of your income, which I will show a bit later. And last and very important is there's an economic cost to the lost development potential of children. The lost IQ and the poorer school performance associated with poor breastfeeding has an economic cost later in life when these children become adults and enter the workforce. So in Thailand, up to 50% of child deaths in children under 2 due to pneumonia and diarrhea could be prevented every year by improving breastfeeding. 10% of maternal deaths due to breast cancer as well could be prevented every year. What that means is we can save 262, or almost a little under 300 lives of infants below 2 years every year, and 515 lives of mothers who could die from breast cancer. This is every year in Thailand. We could save the healthcare system of Thailand $7.65 million every year. This is annual savings of your health system by eliminating diarrhea and pneumonia that could be prevented by improved breastfeeding. So we often talk about that breastfeeding preventing diarrhea and pneumonia other than saving lives. This is also saving our economy and our healthcare system a significant amount of money. The cognitive savings, this is preventing children from, so when we breastfeed, we help children achieve their development potential. If you remember the brain I showed you earlier, that is the physical sign, but the cognitive sign is when the child is in school, is when the child is working as an adult. And these cognitive savings have been estimated to be $192.6 million per year. We are saving this money by ensuring that children reach their development potential by improving breastfeeding. So the direct cost of buying infant formula amounts to almost 1/4 of a worker's earnings. Almost 1/4, and this is based on an estimate of budget or economy infant formula. What more if they buy the more expensive infant formula? In the Philippines, a similar analysis was done, and in some families, up to 70% of their income is spent on infant formula. Imagine that, 70%. So to summarize, we know that the recent evidence now shows again something that all of us here already know, that breastfeeding is the best buy. It's the most cost-effective intervention from a global health and public health perspective to save lives and also to improve social outcomes. Outcomes in education, outcomes in earning potential, outcomes in productivity, not only of children but of the population as a whole. And if we want to invest in human capital development in Thailand, then breastfeeding is the first step, because we want to avoid the irreversible growth faltering that happens in the first 2 years of life. But also to highlight, one of the key findings is that longer breastfeeding is associated with an increase in IQ of an average of 3 points. And this increase in IQ translates to improved school performance and increased earning potential. So, to highlight again the point of why breastfeeding should be continued, not only for 6 months, but not only to 1 year, but up to 2 years and beyond. So the evidence not only shows the benefit, but it also shows us what we need to do and what works to protect, promote, and support breastfeeding. So we know that women are 2.5 times more likely to breastfeed in a community, in a population, in a country where breastfeeding is protected, promoted, and supported. And we know that specific policies will allow a country to do that. We have the way of conducting your health promotion activities that targets behavior change. The health system needs to support breastfeeding by ensuring that children are put to breast immediately after birth, and that mothers have access to good skilled counseling support for breastfeeding, for example. We know that the labor force has a critical role in ensuring that maternity leave benefits are consistent with the recommendation of exclusive breastfeeding. Vietnam has increased their maternity leave to 6 months. The Philippines is trying to do the same. And this is a good example of an evidence-based policy that results in improved breastfeeding practices. But I'm here to focus on a specific policy area, and it's a policy area that protects breastfeeding. I highlight the word protect. So protect, promote, and support, but I'm here to talk about a policy that protects breastfeeding. And that policy is the BMS code. Okay. So the International Code of Marketing of Breast Milk Substitutes, which most of us are probably familiar with, provides guidance on how the marketing practices of formula companies should be restricted to ensure that mothers and families receive the best and most accurate information about how to feed their infants and young children. The International Code was started in 1981, but just last year, the World Health Assembly Resolution 69 updated this to provide guidance on how to end the inappropriate marketing and promotion of foods to infants and young children. It clarifies the scope of the BMS code to include follow-up formula and follow-up milk and growing up milk. I'm not sure what it's called in Thailand, but it's the milk that's being marketed for older children. So the scope specifically recommends 6 to 36 months. It calls for an end to cross-branding. What I mean by cross-branding is when a formula company markets a milk for an older child, but the packaging, the lettering, the color scheme, the image, the logo is the same as infant formula. So the effect is that when you market one, you also market the other. So this calls for an end to that practice. It sets criteria for breastfeeding messages, even in complementary food, because we run the risk of having certain complementary foods to be interpreted as a breast milk substitute. And again, it also benefits from the cross-branding scheme. And it calls an end for industry or formula industry sponsorships of health professionals and scientific meetings. We'll be going more deeper into this topic later. So why regulate breast milk substitutes at all? Why do we need to regulate its marketing? Well, one is that your breastfeeding rates in Thailand are still very low despite an improvement, especially exclusive breastfeeding. And then again, you need to double your exclusive breastfeeding rate again. It started from 12, now it's 23, and you need to reach 50% to meet the global target. So it's another doubling. And it will be very difficult to do when marketing restrictions aren't set in place. And now, the second point is very important. Why we need to regulate marketing and promotion? It's because mothers can only make the best informed feeding choice. I highlight the word informed feeding choice. We've probably done a bit of research or some research in our lives, and we always make sure that when we deal with patients or when we conduct research, our patients are completely aware of the treatment, why we're giving a certain treatment, why we are prescribing a certain drug. And then if they're, let's say, joining a trial, they need to know what are the risks and benefits of joining this trial. This is informed consent. We're all familiar with this concept. Same for feeding choice. We want to protect mothers from receiving misleading information about feeding options that BMS companies tend to do when they market their products. Inappropriate marketing affects the decisions of mothers about how to feed their infant, and we need to protect them from this. And we also know that the BMS itself, its use poses risk. It's not a sterile product. We've heard about the stories of public health consequences or health consequences of using contaminated formula. We've heard a lot of stories from many countries in the world. And we also know that when a mother uses formula instead of breastfeeding, she is also depriving we're also depriving the child of the other benefits in breast milk, such as immune protection from the antibodies that are in breast milk. So we're not only introducing harm, we are depriving the child of immune protection. And this is what protects the child from diarrhea and pneumonia. BMS is not just the powder. You need to mix it with water. You need to make sure it's hygienically prepared. And in Thailand, similar to my country, the Philippines, in the poorest of the poorer parts of the country, clean water is not even assured. So if the product itself is not safe and the water used is not safe, we are introducing a lot of health risks to the child, and none of us want that. And we need a code because evidence again shows that when countries adopt strong marketing regulations, the inappropriate marketing decreases. The code works. The code works, and we know it. And more importantly, the industry also knows that the code works. These are studies from market research, and this is the industry data, this is not our data, from the industry itself. So the graph on the left is from China and India. In China, where there are no regulations, the volume sales of milk formula continue to increase year by year. It's the orange graph. In India, where there are strict marketing regulations, there is no such growth. The sales are steady. This is an example from Indonesia, where the restrictions cover only the standard milk formula and the follow-on milk formula. But there are no restrictions to cover the toddler milks. And we see that where there are no restrictions, the volume sales continue to grow and continue to accelerate. And what this means for the industry is it protects profit. And they are very well aware that countries that have a code, this trend will stop. It essentially means that it works by affecting sales, and the industry knows it. So what's the status of the code in Thailand? I don't think I have to tell you. But compared to other countries, Thailand is one of the countries that continues to have no legal measures. The International Code of Marketing and World Health Assembly Resolution 699 should be adopted into national legislation. In the Philippines, I'm proud to say we're one of the countries where the international code has been taken and converted into a national law with all its provisions complete. In Vietnam, at the moment, that process still has not happened. But we hear that very soon you will have the opportunity rather to change that. And we hope that we hear good news very soon. So, before I end, let me end on a personal note. So, I'm a medical doctor, and I know the benefits of breastfeeding very well. If you give me an exam about the benefits of breastfeeding, I will pass. I will get 100% every time. I could cite all the recent meta-analysis, all the recent cohort trials, randomized studies. But when my wife gave birth, my wife is a pediatrician, we realized several things. That one, despite all our knowledge about breastfeeding, we still had a difficult time starting. Despite being born in a mother-baby-friendly hospital, despite the nurses all encouraging us to breastfeed, which we really loved, we still sometimes are exposed to ads that say that, maybe breastfeeding, you can only do that for 6 months, and then after that, maybe this wonderful milk you can give to your child so the child's brain will grow. So we realize that even if we know all of that, if we continue to be exposed, it still affects us despite all our knowledge. There's an effect. We had to make a decision between the two of us that we are committed to breastfeeding. We have no second option. Breastfeeding is number one. For us, it's not number one, it's the only one. And we are fortunate to be born in a country where we have laws to protect us from marketing. We're fortunate to be born in a hospital, for our children to be born in a hospital that supports early initiation and prevents the provision of samples. And we're fortunate to be surrounded by people and like-minded colleagues and friends who tell us that breastfeeding for us as well is the only option. If you need help, we will support you. So when I say that breastfeeding needs to be protected, promoted, and supported, I say that not only as a medical professional, not only as a doctor, not only as a master of science in global nutrition, but as a father of 2 children. And it's very personal to me, and this is something I'm very passionate about. So in my work in the Philippines to advocate for our own national code, I try to draw from that experience and draw it from the heart, because this is something that all children should have. Not just doctors who know it, not just nurses who know it. This is something that we do for the population, that we do for the country. So with that, I'd like to thank you again for the opportunity to speak. And I hope I hope I didn't confuse you too much. And if you have any questions, please feel free to ask. Again, thank you from Alive and Thrive, and from myself, thank you very much.